Adult bedwetting, enuresis. A lot of folks think bedwetting is something that only happens to kids, but it's a problem that can hit grown-ups, too. You may feel embarrassed to wake up to wet sheets, but it's not your fault. Nocturnal enuresis or bedwetting is the involuntary release of urine during sleep. Bedwetting can be a symptom of bladder control problems like incontinence or overactive bladder or more severe structural issues, like an enlarged prostate or bladder cancer. Studies shows that 1 to 2% of adults wet the bed, though researchers think that statistic is underreported due to the embarrassing nature of the problem. Rather than hiding your secret, you should explore effective treatments that can help lessen the likelihood of bedwetting and reduce the anxiety of going to sleep. What causes enuresis? If you start wetting the bed as an adult, see your doctor. You may hear them call your problem nocturnal enuresis, which is the medical name of the condition. Some of the reasons it may be happening to you. Hormonal causes. Your kidneys make more pee than normal. The body produces an antidiuretic hormone at night called ADH, which slows the kidneys' production of urine while you sleep. In people with enuresis, this hormone is not produced in significant enough quantities to slow the production of urine, which often leads to bedwetting. This can be a symptom of both type 1 and type 2 diabetes. Neurological causes. Your bladder can't hold enough urine. People who suffer enuresis can also have a smaller functional bladder capacity, meaning the amount of urine they can hold before the bladder sends a signal to the brain that it's full is smaller than average. Coupled with overactive bladder or bladder instability, this can lead to bedwetting. Structural causes. Enuresis can also be a symptom of problems in the urethra, prostate or pelvis, including urinary tract infection, urinary tract stones, enlarged prostate, prostate cancer and bladder cancer. Medication and diet. Bedwetting can be a side effect of certain insomnia medications and drugs taken for psychiatric purposes like fluoridazine, clozapine and risperidone. Bladder irritants such as alcohol and caffeine can also contribute to bladder instability and act as diuretics to increase the production of urine. How do you treat bedwetting? Monitoring fluid intake. The first step towards preventing bedwetting is limiting the intake of fluids in the afternoon and evening, which creates a decrease in the amount of urine produced at night. Reduce or avoid caffeine and alcohol intake, which act as diuretics and increase the likelihood of accidents. Try bladder retraining. Go to the bathroom at set times during the day and night. Slowly increase the amount of time between bathroom visits, for example, by 15 minutes at a time. This will train your bladder to hold more fluid. Bedwetting alarm system. Wet detection alarms can be used in underwear or on the bed itself to vibrate or give off sound when bedwetting occurs. This wakes you and allows you to stop the flow of urine and finish in the restroom. Eventually, the body conditions itself to wake before the urge to urinate gets too strong. Waking, setting a random alarm each night to get up and urinate may be helpful in preventing bedwetting. Avoid setting an alarm at the same time each evening in case your body becomes accustomed to emptying at a set time each night. Take medicines. Several can help with bedwetting. Desmopressin, DDAVP, reduces the amount of urine your kidneys make. If medicines and other treatments don't work, your doctor might recommend one of these procedures. Sacral nerve stimulation. It helps control an overactive bladder. Your doctor puts a small device into your body that sends signals to nerves in your lower back that help control the flow of urine. Detrus or myectomy. It's a major operation that treats an overactive bladder. Your surgeon removes part or all of the muscles around your bladder to stop them from contracting at the wrong times.